You've mentioned the symptoms and like diagnosis and everything, but what exactly is the cause of appendicitis? Because sometimes it just happens, like there's
sometimes yes. Most times it's people say that the lumen or the cavity of the appendix got blocked up with they've said everything from peppers from our bell peppers that we are taro to the lumen getting blocked up by seeds that we eat from fruits and all. But the truth is, an inflamed appendix can happen at any time.
So today on Pediatrics To Go, we have Dr. Ekuase Sanusi here, and she's going to be talking about appendicitis. So, Dr. Ekuase Sanusi, how are you doing today?
I'm good. Thank you for having me again.
Yes.
It's always a pleasure to talk about things that are important. So we're talking about appendicitis today because we have a lot of children coming in with appendicitis. Now, what is appendicitis? People say, oh, my belly is hurting. Could I have appendicitis? The appendix, anytime you hear itis in medicine, that means inflammation. So you remember that medical school in the past, my dad actually, when he went to school in the University of Sheffield in England, he said all the medical students had to do Latin before they became doctors. He was an engineer, so he didn't have to do Latin, but he was an effico, so he learned Latin along the way. But appendicitis is actually an inflammation of the appendix. Now, the appendix is actually an organ which is attached to the terminal ileum or the intestines, and it's right at the junction of where the small intestines become the large intestines. So the small intestines are actually the first part of the intestines, and then you have the colon, which is the large intestine. So at that junction, it's almost like a T-shaped junction. You have the appendix right there, which is the size of my finger. Depending on if it's an adult, it's the size of my little finger. But if it's a small child, it's probably half the size. So the appendix is part of the immune system. And anytime there's inflammation of the appendix, is because it's been trying to fight some kind of infection or the other that's present in the child. Or it could just get inflamed for any reason. So we have children coming in with abdominal pain. Sometimes they can localize it and say, oh, my stomach hurts on the right lower side of my abdomen. Sometimes they say the whole thing hurts. They can't even tell you where it hurts. But appendicitis is an inflammation of the appendix. And when the appendix is inflamed, you remember that the appendix is at the junction of the small and large intestines. So sometimes that appendix can rupture. And when it ruptures, remember that the colon, the small intestine and the colon, it holds stool. So if you have an appendix rupturing and you have stool coming into the sterile part of your body, that can cause severe abdominal pain, and that's called peritonitis. And that is also inflammation of the peritoneum, which is the covering or the outside area of the intestines. And when you have that, it can be deadly because people can end up having blood, bacteria in their blood. They can end up with sepsis and people can die. So it's very important for parents, when a child tells you, my stomach is hurting, there are other symptoms that go with it. Sure. So when a child has an appendicitis, guess what? They don't want to eat. So your child is complaining, oh, my belly hurts, and they're eating up a storm. Most likely they don't have appendicitis. But if they have appendicitis, they don't want to eat. And the parents will say, the other thing is they cannot sleep. The parents will say, overnight, the child was complaining about his stomach hurting, didn't want to sleep. So your child cannot eat or has a hard time eating because it hurts too much, or your child is not sleeping at night. If your child doesn't sleep at night, you know that that pain is severe. Wow. And they might not be able to vocalize it and say, oh, it's paining me too much. But if they are not sleeping, take them to see the doctor. So sometimes the pain from the appendix can be around the umbilical area. Or this is the umbilicus. You have your belly button and they might say, oh, the whole stomach hurts. Eventually that pain will localize, but sometimes it doesn't. So if your child is in extreme pain, doubled over and is just cannot get comfortable, that is a red flag. Because if your child is irritable, so fussy that no matter what you do, the child is crying, or they are drawing their legs up and they're just extremely uncomfortable, that could also be something else. But once your child is not consolable and does not want to stop crying, please see your doctor. That should be checked out. Now, when you come to us and we see that your child is extremely fussy and the belly, sometimes they don't want you to touch it. That's what we call guarding. When you see a child with guarding, it's like, no, don't touch it because it hurts too much. That's a red flag. Or when you have rebound, we touch this left side of your belly and your child says, ow, and it hurts on the right side. That's called rebound tenderness. So this right side of the stomach where the appendix is based is called the McBurney's point. And the reason I want to talk about that is because people try and say, I know where the McBurney's point is in the middle, is up here. No, it's on the right side. And if there's McBurney's point tenderness, then your child has an appendicitis until proven otherwise. Now, what do we do when we suspect an appendix that is inflamed or ruptured? The number one thing that we want to do is have your child go to an emergency room or a high acuity center where they can do surgery. So as a pediatrician, I'll send you, you come to my office, I'll send you to where the surgeons are, because that is an acute abdomen. Anytime there's an acute abdomen, that means surgery needs to be done immediately, as soon as possible.
Sorry to cut you short. So that means there are two types of appendicitis. I know there's like the chronic and acute appendicitis, or...
The chronic appendicitis is an appendicitis that has not been diagnosed in the acute phase, and the pain has been going on for a while, and sometimes the child might end up having an appendiceal mass, which is when the stomach lining walls itself around the appendix to prevent it from rupturing and spilling the poop into the body. So the body is also kind of helping to try and prevent a catastrophe from happening. Wow. Now, I haven't seen any child that has had a chronic appendicitis, so just because
acute.
Most times it's acute, but I'm sure there are children that have chronic right lower quadrant pain. But if it's severe enough to make the child uncomfortable, then most times it will be an acute appendicitis with chronic right lower quadrant pain. So chronic appendicitis, in my world, I haven't seen it. I haven't seen it. But most times when a child has right lower quadrant pain, that's an acute abdominal emergency, and it needs to be taken care of as soon as possible. Now, what are the tests that we do? We do blood tests. If your appendix is inflamed, the white count will be high. We also do urine, because you might have protein in your urine based on the fact that the appendix is inflamed. The other thing we do, very important, ultrasound. But the problem with ultrasounds in Nigeria, you want to go to a very experienced ultrasound specialist to do it, because sometimes the ultrasound might say, it's normal, and it's not.
Yeah, that was what I was going to ask. Like, some scans don't even detect.
The scan is only as good as the person doing it. So if the person doing it is not experienced, they can miss a lot. The other thing you can do is a CT scan, because a CT scan will show when an appendix is inflamed.
I thought CT scan was just for the brain.
No, CT scan is for every part of the body. In fact, when you have accidents, the reason we do CT scans is because it can localize blood in spaces where it's not supposed to be. So CT scans can also be used to check for an appendicitis. But generally, sometimes if the child is extremely sick, sometimes the surgeon, it's always good to get imaging, but sometimes if the images are not available, or imaging studies aren't available, the surgeons will take a child into the operating room to go and do an exploratory laparoscopy. Basically, open up your abdomen to see what's wrong, take out the appendix, and look for anything else that could be the cause of that child's acute abdomen. But most times when you see a child coming in, they haven't eaten, they haven't slept, they have not had any vomiting, or sometimes they'll have vomiting.
Yes, that's good.
Yes, vomiting, or sometimes they'll have diarrhea. Sometimes they have both, but any child that is just cannot get comfortable and has severe abdominal pain, or even just abdominal pain that is like, it's not going away, the child might need to have a workup for appendicitis. And that includes blood tests, urine tests, and imaging, ultrasound or CT scan. If your doctor is saying, let's watch and see, and you're uncomfortable with it, get a second opinion. It's always safer to get a second opinion than to have a child that is dead because it wasn't taken up as an emergency. So please, whatever you do, always have your child checked out, especially for severe abdominal pain. Now, I've seen a lot of children that come in with constipation, and they will have severe pain. Oh, it hurts, and they're extremely uncomfortable. And then we do x-rays, and they have poop all the way up to their stomach. Everything is packed full. Now, the difference between appendicitis and constipation is that with constipation, when there'll be areas of waxing and waning of the pain. Okay. With an inflamed appendix, the pain never goes away. But with constipation, that pain will come, they'll be doubled over, extremely uncomfortable, and then next minute they're fine. And usually with constipation, the pain is common after they eat, because you have all this poop moving. There's something called a gastrocolic reflex, where the food is moving along, and that causes pain because the poop is so big and it's stretching the GI tract. So children will double over and say, it hurts. Once the food stops moving or the poop stops moving, then they are fine. And most of those children, when you see them, they're playing around and they're happy. An appendix, the child with an appendix
can't play around.
They're not laughing with you, and they're not playing. And their face, they look miserable. So always take it seriously, because that's a red flag. And sometimes just seeing a child coming in with abdominal pain and looking at the vital signs, a child that is in pain, guess what? Their heart rate will be up. A child that is in pain, they'll be breathing very fast. So even for the time I see the chief complaint, abdominal pain, if their white count is high, you better go ahead and check and make sure that there's no appendix there, because they might not be in severe pain, but the fact that they have pain enough to raise their heart rates and their respiratory rates, that's already a red flag. Check it out and do more imaging than just thinking that, oh, it's nothing, when it could be something.
So that means, is the treatment for appendicitis must it always be surgery?
Yes, it's always surgery, yes. If you don't go in and take out that appendix, then you risk that child rupturing their abdomen, their GI tract. And if there's a GI tract rupture, like I told you before, it can cause all kinds of sepsis, and children die from ruptured. By the time you are doing an X-ray and there's blood, there's air underneath the diaphragm, between the liver and the diaphragm, that means there's a rupture, there's air in the peritoneal space. In fact, those children, they're in so much pain, and they are septic. They are so sick. Most times, even after they've gone and done the surgery and come out, they're in the ICU. They can spend like 2-3 weeks in the ICU just to recover from getting sepsis. Because remember that when the appendix ruptures, it's stool that has all kinds of bacteria in it. You have Enterococcus E. coli that is now basically spilled into the GI tract, the stomach, the abdominal cavity, where it's supposed to be sterile. And now you have all kinds of bacteria inside the abdominal cavity. It now gets into the blood, because the peritoneum has a lining that absorbs all this poop. So you're almost like pouring poop into the blood, and the child ends up being extremely septic. So they have to be on IV antibiotics for days to weeks to months. Some children are never the same after this. So it's important to have it diagnosed early and treated early. But even for the doctors that are listening to this program, sometimes just look at just take a look at the heart rate and the respiratory. If that child is breathing fast and the heart rate is up, something is going on. And in my experience, it doesn't hurt to do blood work and check and make sure the ultrasound is fine, because if you don't, the child who you say, oh, it's fine, might end up being the one that will have a ruptured appendix, because they'll think, oh, the doctor said it was fine and there's nothing wrong with the child.
That's a common problem we have here in Nigeria. They assume everything is fine, and before like 2 to 3 days, the person is gone.
Now, the numbers don't lie. If you walk in and your blood pressure is up, or sometimes blood pressure is not up, but the heart rate is up, there's something going on with that heart rate, especially if the child has been calm and you've given them a popsicle or something to drink and the heart rate is still up. No vomiting, no diarrhea, but just pain. Investigate closer, and you can't go wrong just checking blood, checking the urine, and doing an ultrasound. Especially abdominal pain, take it seriously. Don't assume abdominal pain is just constipation, because many times that could be a problem. So the child herself or himself will give you a good clue on what's going on. And if you're a doctor that is just new into practice, always err on the side of caution. Check your labs. Do your imaging studies. Do an ultrasound. You can't go wrong just checking out. I personally, after all the years I've been in practice, I always prefer to do blood work. In fact, sometimes it's like, you are overdoing it, but you can never overdo good medicine. Sure. It's always better to check things out and know that,
to be sure,
and know that everything is fine. I checked and it was fine, than to have sleepless nights because, oh my goodness, this poor child, it got worse. She or he got worse. And there's nothing I can do now. I don't like things like that. So I always prefer get it checked out. If your doctor thinks your child is fine at the time they're seeing your child, if you're not worried about the child and the child is back to normal, fine. But if you're still worried about the child, always get a second opinion.
Okay, so final question. Like you've mentioned the symptoms and like diagnosis and everything, but what exactly is the cause of appendicitis? Because sometimes it just happens. Like there's
sometimes yes. Most times it's people say, oh, that the lumen or the cavity of the appendix got blocked up with. They've said everything from peppers from our bell peppers that we are taro to the lumen getting blocked up by seeds that we eat from fruits and all. But the truth is, an inflamed appendix can happen at any time. Wow. And because it's part of the immune system is fighting something. Most times there's something that the appendix is trying to fight. And because it's part of the immune system, it can just get inflamed. So people say there's really no use for the appendix, but it has some immune uses. So we don't really know. Sometimes it just gets inflamed, and that's the way it is. But irregardless of whatever caused an appendicitis, it needs to be treated by surgical removal. So always err on the side of seeing a surgeon. Let them take that thing out before it causes more problems. It's always safer.
Well, thank you so much, Dr. Sanusi, for your time. And so you know that not all pains is actually constipation. It could be appendicitis. So pay attention to the vital signs in your children. Send in your questions at Pediatrics To Go.
Yes.
Follow us on Instagram, subscribe to the YouTube channel, and we'll see you again next time in our next episode. Thank you.